So we've got a kind of a whole range of contributors from, again, we've got the private sector, we've got a politician, we've got the commission, etc., and even a doctor to boot again on this panel. So it's good to have you all with us. We had a really lively conversation in the first session, obviously about innovation and the importance of innovation to be hardwired into how we provide healthcare, but also how we look into the future of healthcare. What this conversation is about is how do we make sure, as Gaia was just saying, that we kind of create a default position in our heads that decarbonisation and health and public policy on health should be hand in hand. They should all be connected, that we need to make sure that the carbon footprint of health is not outweighed by the benefit it seeks to achieve. And what we're finding is it's between 6 to 8% is contributing towards that. Ramanella, thank you for joining us. I know you can't be here in person, Marina, so it's good to have you here with us. And I'm going to start with you. It's very clear in the report that, you stress that, health, global greenhouse gas emissions in 22 between 4 to 6% in relation to global healthcare, right? I'm not sure whether you were able to watch Gaia, which was very sobering indeed. Given what you've heard, tell us a little bit about what you're doing in terms of accelerating solutions for decarbonisation of the health sector. And thank you for joining us.
Thank you. Atul, thank you so much for having me, and particularly thank you so much for accommodating for remote participation. You always have the most wonderful hybrid events, so thank you so much for that. So as you might have heard, I am the executive director for a big collaboration called the Lancet Countdown. And what we do is produce data and indicators that monitors the health impacts of climate change and how our actions to tackle climate change, or actually our inaction more often than not, is delivering health benefits or delivering health harms. So I think that the talk now from Gaia was really sobering and lays out much of what our data is showing. And as part of that, we do focus, as you said, on healthcare sector emissions. So we monitor year on year how the health sector emissions are changing. And what we see is that there's a lot of wasteful resource usage, particularly in high-income countries. In countries like the US, Australia, Canada are very wasteful in their resources. But even here in Europe, where countries generally have much more efficient health systems, there's a lot of carbon and environmental footprint that comes from the health system, which is not only damaging our health through exacerbating climate change. As you said, we estimate about a 4.6% of all global greenhouse gas emissions today comes from the global health sector. But it also harms our health because of the environmental damage that it generates, the environmental waste. We're tracking, for example, the loss of healthy lives associated with the air pollution that comes from the health sector's activities. And that's why we say when we provide care, we need to ensure that our healthcare provision is sustainable and is healthy. That is kind of one of the essential components of decarbonization of the health sector. So we identify where the carbon footprint comes, what we need to be doing in terms of tackling it. There's obvious culprits of this. One of it is our anesthetic anesthetic gases that are very high and very potent greenhouse gases, and that we know we can, in most cases, safely replace them for injectable anesthetics. Another area of obvious concern is inhalers, that as well, we have alternatives that are not based on a carbon intensive or a strong greenhouse gas propellant gas, but actually are powder inhalers that can be used by people with asthma or other conditions that need inhalers safely. Okay. And then there's all of the efficiency of the way that we provide healthcare, driving a bit more towards primary prevention, reducing excessive interventionist healthcare, to empower people to take care of their own health and to deliver healthy livelihoods. And this, beside the kind of imperative of delivering care without doing harm and making the best use of our resources, there's the other side of that. That is that we're globally committed to tackling climate change. Most countries will have a legally binding commitment to reducing their greenhouse gas emissions. And the health sector is a big part of the contributions of, to greenhouse gases of many countries. So we will have inevitably to learn how to deliver care in a net zero world. And we need to learn how to do that really fast to ensure that the quality of care that we're providing is excellent. Right. So we're now working with colleagues in Yale, a professor called Jody Sherman, to do a new commission on sustainable healthcare to understand how to make that transition. And that will be crucial, not only for high-income countries, but also for the low-middle-income countries that are strengthening their health systems as they should, that they're moving towards universal health coverage, to understand how to do that in an environmentally friendly way that protects people's health and people's livelihoods.
Great, thank you. But I suppose there's no but. I was just thinking, there's a sense that people are going to think that getting me healthy is actually far more important. And when I think about oil and gas companies, they're the ones who are the polluters, really. It's not the health sector. And why prioritize this when you should be taxing and stopping fossil fuel producers from doing that? You come across that argument, I'm sure, a lot. How are you responding to that?
Well, the emissions that come from oil and gas happen at point of use. So happen when we consume electricity, happen when we consume petrol. So what we need to be doing, as well as regulating the energy sector and the oil and gas companies, absolutely, there's very effective interventions that we know of to do that, including carbon pricing. We have data that shows that even in 2020, when we were at the midst of the COVID-19 pandemic, 78% of countries around the world were still subsidizing very heavily fossil fuels for a global total of $304 billion that year alone. So we know how to regulate the oil and gas sector. There's a lot of lobbying and there's a lot of need still from countries that have refused to transition to renewable energies to persist in the consumption of fossil fuels. But when we look at the oil and the health sector, the health sector contributes to about 10% of all global GDP. So the health sector is an enormous contributor to the global economy, and it's an enormous driver. As I said, 4.6% of all global greenhouse gas emissions make it, if it were a country, the 5th largest contributor in the world. So decarbonizing our health sector can have ripple effects to the global economy. And starting from home, starting from healthcare, and ensuring that we're not harming health through our own activities is crucially important, particularly in those countries where, as I said, the health sector is wasteful, is highly contaminating, and it's harming people's health while trying to provide care.
Great. Thank you for responding effectively to that. But you're quite right. You know, it's quite powerful when you say that when you turn that percentage into a country that's the 5th largest, contributor, it makes it much more kind of, you can see it, you can feel it more specifically. Thank you for that, Marina. I'm going to come to our minister from Latvia. Thank you for being here with us in person. And Hamza, what would be good to hear from you is what are the practices that you can share from Latvia that are doing that thing of combining climate and healthcare as being a good thing as we move forward? Please just grab the mic. Thank you. And thank you for being here again.
Yeah, thank you very much.
Sorry? It's on.
It's on, yeah. First of all, I highly appreciate the invitation to this meeting. Actually, it's a good time and good place and among friends. Actually, I myself have tried to keep this topic on my agenda nationally and internationally. So I have participated in COP28 in Dubai last year. And as you might know, we adopted a landmark document, the Declaration on Climate and Health. So it was the first ever event connection climate and health together. And I hope in this year in Baku, we are going to continue discussing this topic. In Latvia, we have many negative effects of climate change on health. Actually, we have increased prevalence of infectious intestinal diseases. So I'm a gastroenterologist. And in my daily clinic, I see many patients with intestinal diseases. And of course, we have increase in morbidity and mortality from chronic diseases like cardiovascular diseases and chronic respiratory diseases also. And we have a small vector-borne parasite, ticks parasites, not like mosquito, because of heat waves, it's also increased in numbers. So we have additional cases, especially in spring and in summer. And that's why the health climate nexus, we took it as a part, an important part of our policy in the new government. So after the parliamentary election in 2022, we established a new ministry on climate and energy. So this is the first step toward a strict policy from our government. And then Latvia has adopted several strategic action plans that integrate, among other, climate and health policies. So we have two main plans: the National Energy and Climate Plan 2021-2030 and National Adaptation to Climate Change Plan until 2030. And these plans have introduced various measures that funded either from the state budget or from external sources, for instance, EU. But the main measure include public awareness campaigns. So, for example, for instance, in heat waves, we published prevention measures through news, social media, and so on. And we are also working and very actively on fighting against antimicrobial resistance, because it's a global issue, and I know that WHO we had several meetings on this topic, and we are going to discuss this topic on this year September in United Nations, and of course educating people with chronic diseases on preventive measures during heat waves and monitoring of related morbidity and mortality indicators, very important. Regarding the hospitals, because I believe that if we want to connect climate together with health, so we have three main pillars: the infrastructures of the medical institution, a healthy lifestyle of the population, because if you are not going if you are healthy, so you are not going to hospital, and the consumption of different material and waste produced from the hospital in the time of diagnosis and treatment. So, for example, during the pandemic and after the pandemic, I know that we are using billions of masks and medical robes and gloves. Before the pandemic, we were not using too many masks and gloves in daily, ordinary days. So we have to look back for the guidelines to use such masks and robes and gloves. And talking about decarbonization of the system, so we promote energy efficiency, ventilation, air conditioning, and the sustainable waste management. So we are working very, very close, including what we call it biological and hazardous waste. And of course, finally, I should note that digitalization of healthcare is very important, because using of electronic document reduce waste in a way, So I'm also glad to know that we have a lot of ideas and different plans in future, and we're having a good cooperation with so-called small initiative countries, because we are from different regions. So we are talking about Baltic states, we are talking about the Mediterranean part of Europe, we are talking about Central Europe. So we have different regions, different atmosphere, and different challenges. And I mean collaboration between small countries. It could be an example for big countries. If you will compare, for example, Latvia consumption and United States or China or India, maybe today I will not be very popular, but we have to criticize that big countries, they have to do their own homework and their own job. Thank you very much.
Great. Thank you very much for sharing some of that. You spoke the ones following the elections. You had this new ministry created. So is there kind of, I suppose it's not a yes or no question, but what happened in that early stage of the cabinet development or the development of ministerial portfolios that enabled people to kind of think that way? Was it a party political issue or? Just to give us a sense.
Traditionally people, they don't want to change anything in their own life. So they just keep going forward, and it's not easy to make any reform, But the last surveys showing that 73% of the Latvian resident, they start to think that climate affect their own health and their own life. And so establish such a ministry and preparing such a plan, a national plan, is very important to give a signal for the resident that we are going forward for the better part, And I believe that in Latvia and all over Europe, when we have the last European Parliament election, so we see that a lot of political groups, they were talking about the green goals and the climate changes and how we have to move forward. And in Latvia, such a political group, they won the election. So this is a signal from the resident, from the people of Latvia, that they want to have these changes and they want to participate for getting better life in future.
Thank you. So it's both a bottom-up and top-down approach. Excellent. Good to know. And good to we'll look forward to next year even thinking about what much more progress you have made on the kind of this agenda in particular on climate and health, making that policy work on the ground. Thank you for that. I'm going to move to Patrick. Patrick, if I may. Robert, sorry. Why did I put Patrick in my head? Robert, thank you very much. That's, Philip's funding gone down the toilet, unfortunately. No, thank you for being with us. You've made public your vision for healthcare for 2030. So, as a company, you've really kind of marked your territory. You've set out what you want to do. Can you share with us a little bit about what that means for Philips, but also then tip into the conversation about what are the pathways available to us in Europe to kind of build sectoral change and, accelerate the transition in many ways.
Yeah, thank you. And let me just build on what His Excellency the Minister said, and also Guy and Marina, thanks for the introductions. I think that change is necessary is abundantly clear. I also live in a very small country, like evident, by the way, 2 meters below the sea level, so we have skin in the game. And building on your example, small countries could lead, but so could the healthcare sector. I will come to your question, but I think also if the healthcare sector manages to make the transition, it would be truly inspiring. And oil companies and construction companies and whatsoever would have even one excuse less to not follow suit, right? Because healthcare sector is so complex and complicated. So I think if doctors and we as members of that healthcare sector can show that it can be done in a sector that's typically hard to abate. As you said, the fifth largest emitter, if it would be a state, actually emitting more than all airlines together. Yeah. I think if we show that, that would be truly inspiring. Technology and Philips. I think technology is a very important part of what we see. There's a huge digitalization wave of going on in healthcare. We know that the healthcare sector is in transformation and needs to continue to change because of shortage of doctors and healthcare professionals, rising costs, and so forth. So something will change and is changing already. So why not do it in a way that is also beneficial for the environment? Health technology alone will not save us. There's also a huge behavioral component. There's capabilities. There's a lot of things next to technology, but technology is a huge enabler. Let me give some examples. We are since a very long time in health technology. Philips is 134 years old this year. And we started eco-designing our products in the late 1990s. And then in the early 2000s, we started to mainstream that with investing, for instance, in the first EcoVision program, 1 billion euros, and the second one, 2 billion euros, to really mainstream eco-design to basically everything that we put on the market. We have been producing in carbon neutral environments since 2020, one of the first health technology companies in the world. We have 100% green electricity globally. We committed to science-based targets for scope 1, 2, and 3, also as the first health tech company. And with the stuff that we have learned in becoming carbon neutral in our own operations, we are educating our suppliers. We have about 15,000 bill of material suppliers. So that's all in the supply chains of the hospitals, right? And we know that about 70% of the environmental impact of a hospital is not in the hospital, but in the supply chains and around. So when we are able to address and convey these messages to our suppliers, that has massive impact also on what happens basically in the use phase and the embedded carbon. By next year, we hope that half of our global supply chain has committed to science-based targets, which is beautiful because it's externally validated. And all these companies have to report actual progress year on year also. I could go on, but let me just say what's really exciting is teaming up with our customers, with the big care providers around the world, and really figuring out where the impact is, what can be done, and how better clinical outcomes and better lower environmental footprint go hand in hand when you really focus on a patient-centric perspective. Right? Somebody, it hasn't been said today, but the best hospital is the one that we do not need to build, right? I think there was a question in the previous discussion around prevention, also healthy living, first-time right diagnosis, early intervention, minimally invasive therapy so that you don't have these long hospital stays, being able to treat people out of these high-cost, high-energy-intensive care settings, being able to monitor people in the general ward or even at home, and being able to intervene if the conditions deteriorate. So really understanding what the environmental footprint of an entire patient journey is, and then thinking with hospitals what we can do to help them mitigate that while delivering equipment that is very energy efficient, produced in a low carbon environment, in a circular fashion, for instance, being able to take back all the large scale medical equipment. I think that are things that are scalable and that are inspiring. But as I said, technology alone is not going to save us. So it takes a lot, including collaboration. Yeah.
Robert, thank you. Are you doing it? You'll always be Patrick in my head, by the way. So if I said that again, do apologize.
I don't mind.
This,
you can call me Patrick today.
Okay.
You can call me Al.
For some reason. I don't know why. So, but are you kind of doing some kind of future designing process of what it might look like? Because we had this conversation yesterday, and earlier on we were saying that, if politicians could work early on with people like you as a company to say, these are kind of solutions that we could be pulling together if we understand need, if we understand the politics, but actually we have the know-how. Are you doing some of that kind of design work for the future of healthcare? Because you're right. I'm not letting you ask the question, but if we think about the pace of digitalization, hospitals of the future don't have to be bricks and mortar. Please.
Exactly. It's also about care delivery. So yes, we do that. For instance, now we are reaching the end of our 5-year commitments on sustainability next year. So we're thinking around targets for 2030. And to do that, we are looking into healthcare in 2050 and then backcasting towards 2040, 2030, and so forth. What does it mean? If you are committed to science-based targets, that means for scope 1, 2, and 3, that every engineer that's working on the next generation MR scanner or CT scanner needs to know how energy efficient that platform needs to be that will be released in the market maybe in 2 years, maybe in 5 years, maybe in 10 years from now, and so forth. So, but the critical thing, and I think we all are very aware of that, these are not product properties. Of course, you can make a light bulb more energy efficient. You can an MR scanner more energy efficient. You can even run it without in a closed loop system so that it runs with 7 liters of helium all of its lifetime. But it's really critical to understand how it is used and embedded in the clinical flows in the hospital in reality. So you need to work together. It's not just designing the products, it's designing how care is delivered, how care flows are organized in the hospital, and that you need to do together. Yeah.
And are you hopeful in terms of what you see so far?
I'm super excited. So we are really teaming up with very big care providers around the world and governance, of course, to understand who is willing to show that it can be done. Just maybe naming one example out of many, but Some of you may know Champalimaud Foundation, leading cancer research institute.
Just repeat that again.
The Champalimaud Foundation,
Okay.
Portugal, leading cancer research institute. So we have teamed up last year with them on a 5-year program to help them reduce their operational carbon emissions with 50% in 5 years' time, in collaboration. So, and we see many of that in the United States, in Australia, others in Europe, where we show what it looks like in practice, working together with Healthcare Without Harm and others to really help that this type of knowledge also becomes more widely available.
It would be great if, companies like yourselves and BMS and others were to work with, let's say, even the 3 examples we had earlier on, in terms of Tomislav, Vlad and Jakub. They're saying that infrastructure, and even we're talking about Latvia, the infrastructure is so poor in certain ways that, things that we take for granted here, or France and elsewhere, they simply don't have. And so we've got this inequity of healthcare, and it would be great if the private sector could even bolster its support in those areas more.
Yeah, we have a very strong opinion on that, but I don't want to hog the microphone. I think so many interesting people, including real doctors on there, but happy to comment if you have any questions. So access to care, we have a target, 400 million people, access to care from underserved communities in 2030. So,
we'll come back to you on that. Yeah. Excellent, thank you very much. Okay, over to you guys now. You've been listening quite some time. It's rather hot in here, I think, as well, but I understand that, but we're trying not to use too much air conditioning because it's obviously bad for you. And also, it's a carbon, a producer. So, your reactions to what you've heard so far?
The sea climate is very complicated.
Sorry? Yeah.
I mean, the climate topic is very complicated.
Indeed, absolutely. My friend, again, be helpful again.
Fokko Wieringa from the Netherlands. I'm a medical technologist. As we saw the wet bulb and the dry bulb temperature measurements in the previous one, we are experiencing this now. We haven't the air too hot, too cool, and we feel it. And the organs that are heavily helping us to live on the land are the kidneys. If we wouldn't have regaining or recycling of the water back, we would have to drink 120 liters a day. So our kidneys, they concentrate the urine, and that's how we can live on the land. And they are also heavily affected by these higher temperatures, and especially people that work on the land. Maybe you know about the sugarcane cutters in the hot climates. They have been heavily affected, but we also see it now in Europe, that in these heat waves, that people have trouble with their kidneys due to the heat. So that is again accelerating our. It's affecting our health. And on the other hand, I can't help it, this morning I had a round table explaining how incredibly expensive and how incredibly high the eco footprint is of hemodialysis, which is one of the most expensive treatments we have, but also one of the most wasteful treatments that we have. We use a lot of water and a lot of electricity with that, and we can do better. Now, I think the whole general thing is we have to relearn that we should not throw away stuff if it's still good to work with. I mean, a scissors or a pin set that is perfectly fine after the treatment that we throw away now, that is a bit of a waste. So thinking about that, and as you said, from the beginning on, with the onset of the medical device design, it would be good to think about what is our waste stream coming out of it, and can we regain that waste? Maybe indeed taking a new one is a good one if you want to keep it sterile, but at least that the one that's thrown away can be reprocessed in some way.
Thank you very much. Whilst you will think about that, and perhaps I'll pick on one of you if you're not going to put your hand up. Let me give you some information from citizens. So we've spoken to 2,024 citizens last year as a lead up to the elections this year, and we launched a report called Voices, 2024 Voices, and we ask a number of questions of citizens around things like cost of living. What do they think about climate, trust, etc.? And it's quite interesting that we had, I'm just going to pick out, I'm not going to quote each of them, but you had a woman from Belgium, Lotte, between the ages of 31 and 40. You had Anna from Begonia in Spain, 18 to 30, and Andre, who's 31 to 40 from Poland. very different places saying exactly the same thing, that we need to be thinking about we need to be thinking about making sure we make the connection between the impact of climate on our health, and that we need to radically accelerate the use of digitalization. One of them quotes that, having drones that are able to capture hornets, for example, and create a different system of, air pollution, health as well, using technology of drones to do that in a different way, as an example. So you've got people from these various age groups across Europe saying they get it, they want to make it more, and actually use technology even further in how we are managing our present and have to think about our future. Any questions further? Any kind of comments? I'm catching the eye of an emeritus professor by the name of Frank. Please, share your thoughts.
Frank Rademakers, KU Leuven, Belgium. Yes, technology can be a solution, but as it was measured, as was said already a couple of times, it's only in the way that we use it. And we have to show for every technology that it is doing what it is supposed to do, and that the effect of it is really helping the end user, being the citizen or the patient. And I'm always a little bit hesitant of new toys for boys, where we say, oh, this is something fantastic, we have to use it, we have to do it, without showing it in an appropriate scientific way. It's also the fact that the healthcare providers, the physicians, etc., will only trust devices and new technology when they've been shown to have scientific proof of efficiency and effectiveness. And that's true for hard technology, it's true for software, it's true for AI, etc. So yes, technology is important, but please let us do the proper scientific background to show that it does what it needs to do.
And would you be a supporter of, because at the moment we know that the research and the data collection, the trials goes on for years, right, before we get things to the market. What's your response to using quantum computing and be able to accelerate? I mean, isn't that what happened in terms of the vaccine that came that we were able to create in such a short period of time? But I might be wrong.
Yeah, but again, it's the computing power is one thing. But again, having the proper trial setups to show what the effect is of whatever the treatments that you're devising, that's crucial. And I think we've been using RCTs, randomized controlled clinical trials, and they're very good because they have cause effect. You can show it. But there are many other ways now in registry type of trials. There have been new possibilities in real life trials where we can show also the effectiveness of new treatments. And they're less costly, they're faster, and they're much easier afterwards to implement results of these trials because they have a much broader background of people in which they were tested. So yes, again, technology can help, but I think it's also in the way that we operate new trial designs to show the way that things are really working.
Great, thank you. That combination is always important. Let's not use the principles of good science. Okay, I'm not going to flog a dead horse because I don't see any hands up. So I'm going to go back to the panel. But thank you. I'm sure you'll kind of have other issues to raise in due time. I'm going to go to Evelyn, if I may now. You set up something which was quite interesting as a doctor. Wanted to create an alliance of doctors that felt and believed that greening the health system was important. Tell us a little bit about why. And, you've kind of grown exponentially, but tell us a little bit about that story. What was the kind of, how do you manage to get even the small group to be convinced that it's the right thing to do when you're meant to be, looking after patients?
I think it has already been said before, but also for me as a young medical doctor, and idealistically, I'm doing my job because I want to improve health of people. And then just seeing all the waste that we generate and all the medications that we just throw away because, they haven't been used, or all the plastics, all the emissions. And then there are reports like Marina's that really opened my eyes because they translated what I saw on a daily basis with the bigger picture. And then there's this paradox where I want to improve health of the individual in front of me, but through the back door, I'm polluting that much that I'm actually contributing also to unhealthy planet and therefore unhealthy people. And I think, we shouldn't be blind for that, and we can do differently. So a couple of years ago, luckily I wasn't the only one who thought this should be done differently. And I found some like-minded people, and we thought, well, maybe we should just organize in the Netherlands a network evening where we bring together the people that work on this. And by that time, that was 3 years and 3 months ago, we had 16 such groups. And there was a group of green surgeons and a group of green gynecologists and green GPs. And we brought them together. And it was actually
we would
fantastic.
love to watch that conversation. Great, gynecologist, great. Go on, carry on.
Yeah, but the beautiful thing is we all had the same goal in mind. And there was so much energy that evening, we thought we have to continue this. And then we called ourselves from that moment, that evening onwards, the Green Health Alliance, or in Dutch, de Groene Zorgalliantie. And we wanted to make sure that we accelerate the transition to planetary health, doing so by using health as an argument. And we've discussed this too. Health, you can't be against health. So if we use health as the argument to speed up the transition in society, that would be great. That on the one hand, and on the other hand, we want to make our own practice more sustainable. So then, 3 years, 3 months later, we're no longer 16 of those groups, but 200. And I think we reached the full scope of the healthcare sector. So we have physiotherapists, dietitians, scientists, everyone related to health, and each of those groups represents hundreds to sometimes thousands of healthcare professionals. So we've grown in such a short time to thousands and thousands of healthcare professionals that want to work to planetary health and making our own practice more sustainable. And then we focus on 3 key areas. Mm-hmm. One is sharing knowledge. And we do so by, we have a Green Health podcast, or we published a book, Green Health, Green Planet. It's in Dutch, but if we find a publisher, we'll soon publish it internationally as well, because it's almost sold out in just a couple of months. So
you do know, just across the road, the EU has a translation service which is on par with me, and it's free. Just put it in the system and you'll get it. So perfect. Might want to think about that. Go on, carry on.
Translation service and a publisher would be perfect. We organize such network events where we exchange knowledge. Maybe to Frank's point about, digitalization is always mentioned as, that's the opportunity for more sustainable healthcare. But we just did a research and we found that the CO2 emissions of travel can be much lower by, for example, telemonitoring for follow-up of cardiac disease. But then all the devices that are needed to do the telemonitoring make the overall environmental footprints through a life cycle assessment, so we really measure everything that's involved, 50 times higher. So it's not always a success, and I think we need to be aware of that, and we need to apply digitalization consciously and see where it works and where it doesn't. Well, the good thing is with these network events, we exchange the knowledge and see how we can accelerate. The second point is we want to inspire. We have a yearly Green Health Festival. In the first year, it's attracted 150 healthcare professionals on a free Saturday, so that was already a nice start. The second year it was 750. Let's see what September brings us, but I hope it will continue to exponentially grow like that.
What do? You do get drunk and talk to each other and say, party. What do you do in that festival?
About the alcohol part, I don't know. That depends per person. But in such a festival, we have lots of workshops of the ethical questions that should be discussed in this. But also, how do you perform a life cycle assessment? Like, how do you measure your advancements in sustainability?
And what's the third thing you said you're going to do?
And the third thing is that we use health as the argument in the whole transition in society, and we do it within the healthcare sector. So we convinced our Royal College of Physicians that being aware of the climate and health relationship and also actively act on it as a doctor is a responsibility of a doctor, and that's now one of the 15 codes of conduct. So it has been adopted as the responsibility of doctors. But also we have a large integral health agreement in the Netherlands, het Integrale Zorgakkoord, which is like the entire sector, and sustainability was not going to be included in it. And then we lobbied like crazy until we had sustainability into that. And I think that's also a big milestone for us. But we also do it outside of the healthcare sector. So we, at the COP28, together with Healthcare Without Harm and other international organizations, we lobbied for several years. And we managed to get health as a special day, a health day at COP28. And I think that connection, health and climate, is super important. But also in the national news, we were able to share the knowledge. A couple of million Dutch people watch it. And one of my personal highlights is that we managed to get it into the Libelle. For the Dutch people, this is the most commonly read housewife magazine. And I was rewarded the Libelle Star for the efforts, or nominated Libelle Star. But also, for example, we got an award from the Dutch Financial Times, het Financiële Dagblad, for linking climate change and health. So we try to do it on a political level, on a societal level, but also within our healthcare sector. And it gives me a lot of hope, because before that, reading the reports of Marina, they are quite sobering and sometimes depressing. And I could really lie awake in my bed and think, wow, where are we going? And then if you see how much energy is actually there and how we're accelerating, it gives me a lot of hope. And there's so much energy, bottom up, and so much willingness to collaborate. So if you think you could use our help, or if you think you have something that could help us, I'm super eager to get to know you and see how we can accelerate together. Thank you. It's so great to have a doctor on the panel like you, because you kind of dispel a lot of the myths, and given the way you're talking and expressing yourself. Two things. I imagine that Geert Wilders has never invited you over for coffee to talk about health policy in the Netherlands. And secondly, the demographics, because we heard from Vlad about the average age of a doctor in Europe. Are you kind of representative of that, or is your alliance mostly kind of the 35-year-olds? I must say that I think it's especially the young generation globally that's particularly active. But the good thing is that the alliance is very mixed, and that's super helpful, because you have the more senior people in leadership positions that are also enthusiastic now. And I think particularly on this theme, the intergenerational collaboration is very strong. And have you kind of bitten that very, I suppose, controversial topic of procurement? So I love the three things, okay? But people might say that's great. They feel soft, but it's important to do, and you're coming together. But where it bites, where where the kind of greening of the sector matters, is procurement. Yeah. Also, I think that's a big part of it. But that's why we also link within the healthcare sector. So, for example, the health insurers in the Netherlands, we have a very specific system, but they have a big power also in procurement. And now we work together with them on a national level. We identify the barriers of sustainable procurement from the healthcare professional perspective. And of course, it won't be solved overnight, but I think these are good discussions and quite productive discussions to have everyone on board. No, indeed, Evelyn. I didn't mean to kind of give you just a difficult question deliberately. It's just that those are important. You're doing a fabulous job. And I think the fact that you're presenting in the way you are is absolutely essential to kind of demystify, but also create a different kind of model of what a healthcare professional is about. And really, really good for that. But I think sometimes we need to think about where's the worm in the system that can really change things. Procurement is one of those. I'm not asking you to ask that question. Don't worry. I'm just saying that we have to think about the fact that there's supply and demand, but there's also how you are able to, I suppose, jumpstart something from within that makes it different. And money and procurement are two of those things. But thank you for your contribution. We can come back to you in a moment. I want to move to Sharda. Sharda Das, you are the kind of Secretary General of the what we call the Standing Committee of European Doctors. And so, kind of nice segue from what Evelyn has been saying. Why is this agenda important to doctors in Europe, from your perspective? I mean, is it an upward hill struggle, or is it something that you find that amongst your members that they're getting this?
I think, first of all, thank you. And thank you very much for the very interesting discussions already. I think that this is really a topic where we see quite a quick evolution. So our efforts on this topic have going back more than 15 years. But to begin with, I think there was a lot of individual interest driving this. And I think there was also a lot of, let's say, surprise or novelty of doctors getting involved in this topic. Also, as was said, I remember members of ours going to COP together with a delegation of Healthcare Without Harm, etc. And that was quite a kind of a new type of approach at the time. And there, the discussion was all about climate change and health. So, and I think that has really increased. And now we see, in addition, a lot about this discussion around climate change and healthcare. So what is actually the healthcare sector able to manage? And as you already said, some of these things are really at low scale. It's about procurement. We've heard very interesting examples in the past of hospitals even changing the composition of how they put out food to patients to reduce food waste. But we also see, obviously, and this is where then my organization comes in, what can we do at policy level to also transport all of these ideas, etc., to EU level, but also European level policy. And that is something where we've been working very intensively, for example, on air pollution or air quality rather. We also now we had the cooperation with the Lancet Countdown Policy Brief on heat deaths, which is something that is very close to our members in their daily practice, which they really see an increase in everyday life, which is something also I think which is quite easy for general populations to understand, and it's a very important topic for us also to continue to work on. So from our point of view, it's really about finding, as you were saying, where are there moments in healthcare, but also in other policy areas that have a significant impact, and that can be from the farm to fork strategy, that can be in mobility policies, obviously in pharmaceuticals. That's a big discussion now, how to reduce effluent from production of pharmaceuticals, and it's not only the policy areas which are growing, but I think also really doctors' awareness and their willingness also to commit to lobbying and being ambassadors for health.
Great, thank you very much. Thank you. It's good to hear that that it's not a negative story, that actually it's a positive story, that's actually come from within, which we wouldn't have expected, to be honest. We wouldn't have expected at all. I'm going to, if you hand the mic over to, for last speaker, but obviously not least, you are from the Commission, Elena, and you've been working on climate adaptation, and welcome back to this floor. You've been here several times. You've done a lot of work on resilience and climate resilience, which is really important. Say a little bit about what you've got in the pipeline and what you're planning with this potentially controversial new mandate. We don't know yet. We'll find out by the end of the autumn. But regardless of that, what are you planning in terms of healthcare and decarbonisation?
Well, thank you very much. And first of all, I would say that on health and climate, my feeling is that all stars are being aligned, because there is so much of interest in the topic. This mandate has started with climate activists in the streets, and then us being locked at home during the COVID times. And I think we started to make a very good connection between health and climate, and all the very powerful potential these policies do offer for both health and well-being. This year, we came with the European Climate Risk Assessment that again brings this very stern warning about climate risks. But the way it is framed is relatively simple to understand. It essentially says that we can't look at risks, climate risks, in isolation. And that actually the risks do collaborate better than our policies many times. And that if we are outpaced and let these risks to collaborate, then it can affect our basic needs and the societal functions. And one of our basic needs is, of course, the access to hospital, healthcare, health as such. So I think in terms of the communication, we come out from the realm of complex, complicated, to something that can be relatively well digested. Now, I come from the Commission, we work in frameworks, and also, hopefully, we have some practical, processes in place. Well, first, the frameworks. Two things. The 2040 targets. There is a lot of talk about the costs. And you mentioned the sort of controversial mandate. You will hear a lot about what it will cost us in order to decarbonize. What we need to return to this talk is what it will provide in terms of the long term. It will help us to avoid the most dangerous scenarios that Gaia showed in, localized across the world. And you just imagine it's very much becomes, widespread. And second, in near term, all scenarios that are being studied offer health benefits because it reduces the air pollution, etc. We are acting almost on the same pollutants. Second, on managing climate risks, because we cannot anymore afford to act in, we will now focus on decarbonization and then we will maybe adapt in the future. We have to do all of it at the same time. That's complex, but there is also beauty of it that you act on many of those sectors, like health, where, on the one hand, of course, you go with the sector and the greening, but at the same time, you try to reduce the risks that bring people to the hospitals and really lead to the overflow and to the capacity crunch, whereby we offer measures for protection of workers against heat, which is one of the major risks coming out from the risk assessment. Countermeasures like vaccines, because let's not forget that the climate-sensitive vector-borne diseases indeed are already in Europe. So it is very much necessary to work on it. We have the HERA that was established during this period. Is the Health Preparedness and Response Authority that is now also having fully equipped with the possibilities for measures. So if you want, the path is there. We need to capitalize on what is out there and to continue. I really plead for continuity. In Europe, we have sometimes the mindset of jumping from one to the other, falling quickly into the Sleeping Beauty position, complacency, etc. So let us not fool ourselves by complacency. We just need to continue in the same effort as we are here. Now, on the practical side, we have a major collaborative effort, and it reminds me a little bit of yours, Evelyn, but it's the European Climate and Health Observatory. And there we have and the health professionals and the climate scientists around the table with all the necessary agencies, taking care of occupational health, food safety, WHO, you name it, discussing topics like how to help the health professionals, how to train them, how to raise awareness, how to, work with the national health systems, because let's not forget, we are still, as a commission on health, we are more in a supporting, coordinating, helping position. That's not very much top-down. You can edict a guideline and that goes. How to work on monitoring, early warnings. I fully agree. The prevention is so important, but it's still like the invisible part of the iceberg. Nobody wants to go there because it's just, it's not necessary. At least that's the feeling. So on the European Climate Health Observatory, we are preparing, a work plan with all these partners. We also have a strategic agenda on innovation for climate and health. And, Horizon or our research budget is one of the biggest in the world. Exactly. We never say it so openly and so explicitly, but we have huge public funding for societal challenges. And very importantly, it would sound to you, technocratic, tools, smallish. We work on indicators. We really need to start measuring, visible parts like heat-related morbidity, etc., because this needs to be then translated into clear messages, and this will then meet the eye. It will meet the ear of the politicians who will start talking about it. So we are now pushed by the COP, by the international level, actually, to work on these indicators in different target areas, including health. And so within the next month, there will be an intensive work on it, of course, with member states. And, there is a soup of indicators you can think of, but we really need to fish out from this big soup those that are headlined, that are easy to communicate, and that at the end will push the needle towards action rather than complacency.
Great. It's so great for you're just not the usual suspect from the Commission. It's the first time ever I'm not the person that says that Europe has the largest R&D budget in the world, because Commissioner staff never say it. And it's one of those things. It's the thing that Europe is the most least successful in promoting its success. It's amazing. It doesn't tell the story of the impact it's having on people's lives every day. But that thing about the R&D budget, absolutely right. And there's no kind of recognition of it in the wider world. But imagine if you were to match even half of that with private sector investment. Goodness, what you could do with that money in different ways. Colleagues, I'm almost out of time, actually. Yes, I'm out of time right now. I mean, unless there was a burgeoning thoughts from the audience. Again, you.
Yeah, can't help it.
Okay.
You can also skip.
Not at all. You're always a pleasure.
Well, I was just very encouraged by the medical statement. We have a group here that is called Health Without Harm. And all the medical doctors in the world are bound by the oath of Hippocrates. And the first thing is, first, do no harm. So the medical profession already thousands of years ago recognized that is very important, and you're a great example here. Thank you for that.
Thank you for reminding us of that. You don't have to pass it to me, it's okay. You can hang on to it, or a member of my team will come along. Yes, there he is. He's going to take it off you. You always do that brilliantly, that thing about making sure that we are able to think back to basics, because some of the basics are actually good. It's about interpreting them for the modern century that we fail to do often. Just like what you've just said, is that that no harm principle is it's eternal, but it's about putting it into context. Was there good, no worries. Say who you are, please.
Thank you. Elise Poumet from the Red Cross EU office. I wanted to add two dimensions to the discussion. I think something that was not really mentioned, but is very key in the interlinkages between climate change and public health, is the link with mental health, which is a growing concern across Europe, but not only. And that leads me to my second point, which is the importance of those issues also for the global world. And the EU willing to be a leader on those agenda is very key, that those considerations are also raised in its external action. And you mentioned, and it's great to see here the private sector and to hear from you on this. And when we see the Global Gateway Strategy and the importance that the EU is giving to this investment from the private sector, it's also important that climate and health are integrated into those considerations to make sure that they reach the local actors also, so that it can indeed lead to the resilience of communities, which at the end are those who are in need of health, access to basic health, and who are facing the impact of climate change. Thank you.
No, thank you. But also, you're a very useful, what you do internationally, you don't speak about it publicly, but you go into a situation as a Red Cross, you see the impact of the lack of combining trade, security, aid, and thinking about safety more broadly, but also how we make our planet greener in sharp focus, because you see the impact of the absence of that. And I think one of the things that Red Cross ought to do more of is to be part of the case that you were talking about, Lena. We're going to see the emergence of a group of right-wing leaders who are basically peddling a lie about climate change. And when you've got a community of people who feel so vulnerable and left behind, The right wing makes complex factors really simple. And what we need to do is find a way of narrating that actually, by not doing anything, there'll be a cost, but actually there's a cost of inaction. But we don't have to actually make it feel as if it's it's a totally about a life and death situation. But people need to be able to understand that climate change isn't being made up. And to understand that what's happening to them is real, without scaring the pants off them. Because that mental health point is a really good one, because you've got a generation that's come through COVID. So those who are 10, let's say, are now 13, 14. Visibly different. We've seen that. And when you think about the impact of climate, we're going to see a whole generation of very different people to us in this room. So it's a useful reminder. Just I'm going to come ask each one of you, if I may. So let me start with Marina. Marina, I hope that, the Lancet is also working closely with the IPCC, because I would imagine that, your data and approach should feed theirs and vice versa. What's your one ask of the new mandate? So we'll have a new commission in place by the autumn. We don't know what the characters or personalities will be at this stage, because there was an assumption at one point, but then Meloni has come around saying that no, I'm the new kingmaker now. So boys, watch what you're thinking. So what's your sense of what you'd like from the next mandate? One thing, if there were one thing.
Yeah, thank you. It's, I think, a bit simplistic question. Respecting the Green Deal and committing to decarbonization and to net zero goals. Without decarbonization, there's really no point in any further conversation about climate action, because adaptation will be impossible in the current trajectory. So I think that should be a focus. If you would allow me, though, I would like to go back to some of the conversation that you were just having with some people in the audience. Yeah, there's a kind of very frequent kind of tendency to talk about technological solutions when we talk about climate change and climate change mitigation, but particularly when we talk about healthcare. And I was struck by the intervention talking about kidney disease and dialysis that is so carbon intensive. There's a lot that could be done in terms of prevention, and that gets neglected over and over again. Even in our trials, we're not doing trials of primary prevention and community engagement and community health in Europe. In general, we're focusing more on medical interventions than on primary prevention and community engagement interventions. I was speaking at the Royal College of General Practitioners here in the UK, and there was a wonderful case study about how they managed to reduce the demand for dialysis from kidney patients by strengthening community care and strengthening prevention. And they were focusing on the carbon footprint reduction associated to that. But I think we should not even think about carbon footprint. It's about patient well-being and healthcare costs. So efficiency and prevention needs to be at the core of everything that we do. And efficiency in the management of resources, not only on the health sector, but also in our complete consumption of any sort of resources, needs to be at the core of how we tackle climate change. We cannot be counting on technological solutions to keep unsustainable lifestyles, particularly as we have them in Europe. And I think that is a very important point to be made, even as we talk with private sector and with technology solutions.
Marina, you said what you want from the next mandate brilliantly, absolutely. Because you draw the example of the kidney and the dialysis, etc. But diabetes is so there's one of the things that, if putting aside congenital forms, it is something that can be absolutely resolved in the community, but through exercise, through support, without the reliance on getting more and more and more drugs, which it's become incredible high increase of how much people are, with diabetes taking all sorts of nonsense at the moment, rather than people saying, do more exercise, eat differently, have a different kind of life, for example. So there you go. Maria, Saradas.
So looking ahead, climate change is the one new topic that we have in our health check, which is our vision for the new parliament and the new commission. So that really shows what importance this has gained. I think the message on prevention is very, very important. And it's important. That's why I was saying we need to cross boundaries. We need to tell the people regulating vehicle emissions that they are actually in the position to prevent ill health, which they might not have really on their agenda. And it's so important that as a health sector, we go out and we make these connections where these connections are not being made. Otherwise, we very much believe that the Commission's policies must be continued. The ambition must be strengthened. We also have international partners, and we have to explain to them, well, yes, we have new legislation on air quality, but they're still not aligned with WHO guidelines. So we still have way to go there. And I think working all together is something that we can achieve. And of course, for doctors, we see, yes, we keep having to keep this on the agenda also in education, and to raise awareness among doctors, and to make sure that they have the skills that they need to be able to address not only at clinical level new disease patterns that arise from climate change, but also that they can address these more complex connections with other policies.
Okay, let's hope. Evelyn, because I want to continue the potential connection between you two. What do you want? What was that one ask you have of the new mandate?
Well, I do think that capitalizing on the relation climate and health can be super helpful, also in the current political climate in the Netherlands, but also on a European level. There's this polarization regarding climate, but nobody is against health. So I think if we use health more as an argument, then I would hope Europeans understand why we need to accelerate the transition. And there are so many mutual benefits in health and for the planet. So if we have a cleaner air, or if we use more active transportation, or if we have healthier diets, there are so many win-wins, and I think we need to be stronger in telling the story like that, and it would help to have everyone heading into the same direction rather than polarizing.
One of the things we're going to have to do is get our acts together on telling a better story on this topic, especially for political consumption, but also community consumption. Elena, are you able to say what you want from the next Commission?
Okay, that's perfect. I was fearing that I would be excluded. As a Commission official, next year I will be 20 years in the Commission.
How many years?
Next year I will be 20 years in the Commission. So I was really
she came in as 10.
Conditioned. So what do I wish? My wishes are the following: for the legislation, implement it, please, and follow the course. For the partnerships, let's grow them, scale them up. And for the awareness raising, let's curate it, and let's, make the community, the aware community, bigger and bigger, beyond the bubbles, the converted audiences.
Thank you very much. Can you tweet all that, please? It's really important. Here's a senior Commission official, been there for 20 years. No, it's important, though, the fact that, you're probably 50th person we've spoken to from a Commission background for doing, producing, remind you of this report, right? Look at the cast list. And all of them said, either privately or publicly, let's make the next mandate one about implementation. We've done so much on producing a thick book of regulations, some like, 500 or whatever it is. This has to be the Commission of implementation. So it's refreshing for you to say that, but also that point about make the partnerships bigger and make it a much more an aware community outside the bubble. So thank you very much. I'm going to go to yourself. Hassam, what's your ask? Because you're going to be in a very important position. You are in a very important position. And EBSCO is okay, you're not the council, but you're still a group of health ministers. What's one thing you want from that?
I think we are working in Latvia right now on the implementation of state policy on healthy lifestyle. It's a very important topic, as you mentioned here. Then healthy lifestyle and prevention, of course, is very important. The second topic is what you mentioned today, to believe and to trust. Because, we can write a lot of action plans, we can take a lot of decisions, but you need the society, you need the people just to realize and to believe it. And this is the difficult task for politicians, to talk about your plan and to realize it in future. And of course, the third is budget. You mentioned today the budget and the cost. We have to take in consideration all these topics. But the best things what I've done in the last, in my position as a Minister of Health, that we start to reform the primary care sector. And this is very important also for health and climate together.
It'll be interesting to see. Thank you for that. It's a very good and important sector to be involved in. But we know that the current multi-annual financial framework runs out by 27, let's say. And so the negotiations will start as of next year. And it'll be interesting to see whether, how much the money that's been put aside on health will continue to be there. Let's see if the, people will be brave enough to maintain the budget within. Thank you very much. Last but not least.
I thought you'd never ask.
Robert, aka Patrick.
Yes.
What's your one ask of the Commission, of the new mandate, or your broad ask?
My broad ask. Well, some of you may have seen the Future Health Index 2024 that we've just published last week, where we ask thousands of healthcare executives every year what the future of healthcare looks like. Climate change was on the top for 90% of the healthcare executives. So I would say let's team up to help them. So my ask to the new mandate would also be to think about, first of all, harmonizing green public procurement, to your own suggestion, a big lever where the money goes, the attention goes. The second one would be ensuring that there are national healthcare decarbonization roadmaps. Right? There are a lot of people that are interested in the topic, but can we please help to coordinate and facilitate it a little bit and make somebody at the national level responsible, ideally with a champion at the Commission, right? A healthcare's country side. But if you would have a champion at European level and national coordinators to develop these healthcare decarbonization roadmaps, I think that would go a long way. And then the third one, last one on that, I think the Commission could help with innovation budgets, with capacity building budgets, because healthcare professionals are at the patient's side, at the doctor, at the bedside, so to say. There's not a lot of extra capacity in hospitals to get these kind of things done, but helping to build these capabilities would be super useful. That's my wish list.
Excellent. Very good wishes. Let's hope they listen. Let's hope they are listening. Colleagues, thank you very much for being here. Thank you very much. In our, I spoke to you about the fact we spoke to 2024 people last year, in the last quarter of last year. We asked them the question about security issues, like, because the Ukraine war's on, we see what happened in Gaza, etc. People across the spectrum and across each of the 7 countries that we spoke to felt there's more danger from climate-related disasters than they did war. So just remember that. That's how people are feeling at the moment. Despite a war context, people are more scared about what the natural disasters and the extremities will do to their lives, more so than guns. So on that rosy note, but the rosy note is you. For being here and being so engaged and having a fabulous panel. Thank you all of you. And keep an eye on our website. We have another event happening next week, actually. It's on the 13th, where the Environment Agency is launching a significant report on this topic. I'll be there again with a group of colleagues. I've got the date right, the 13th, right? 3rd. Thank you. I'm so glad I checked. The 3rd of July in the afternoon, where we'll be launching with the European Environment Agency a major report on the transitions and how to mix climate and health and other matters all in one place. So thank you all very much, and thank you, and take care. Have a good week. Thank you.